retinal problem, and I discovered that I almost had a retinal detachment that usually is because someone hits themselves his head or something, or but a trauma or something like an accident, and they hit their heads really hard. So I didn't have that. So
Oh, I was worried about that.
yeah,
I
I
thought
didn't
you,
have
okay.
I didn't have any background of hitting my head or something.
Mm-hmm.
So ophthalmologist told me that maybe we don't know why, but the jelly of the eye,
Mm-hmm.
vitreous humor, it's a little bit jellified. So it probably want to pull out the retin.
Okay.
Good
Hi,
afternoon,
Salome.
teacher. Hi,
Good
Carlita.
afternoon.
Hi,
Hi,
good
Salome.
afternoon.
Good afternoon, guys. Well,
So
that's
Good
that was
afternoon, everyone. Hi,
good
Liz.
afternoon,
good
Liz.
afternoon, Liz. Okay, Carlita, so welcome
Thank
again.
you. Thank you so much. I'm
Uh,
glad to be here again.
I'm glad you're okay, and I hope you can get better.
I hope that too. I hope that.
Yeah, I know. I know you will. Okay, today we're gonna have an interesting topic. I don't know if in your countries you have a lot of problems with mosquitoes or something like that in rural places, especially. At least were telling me last class that you have a problem with, I forgot the disease, but it's because of a bite of a mosquito. Did you remember, Liz? Mm.
Malaria?
No, no, no. Uh, Something that is very common, and maybe, uh-oh,
Ah,
maybe have,
leishmaniasis.
yeah, that is the one.
Yes.
Okay. Besides that, do you have any other problems with mosquitoes?
Yes, in humid weather we have malaria on dengue.
Okay, you have it too.
Mhm.
In Cochabamba, especially, right, Carlita? Because of the
Right,
weather.
exactly. We have this year is one of the worst years because we have deal with COVID and the dengue epidemic. So we have a lot of deaths because of both illnesses.
Yeah, I heard about that. Okay, here we don't have that kind of problems because it's so cold, so we don't have mosquitoes. Thank God. But in rural areas, yes, we have a lot, especially in Coroico. I don't know if you heard about Coroico, guys from Ecuador.
No, I don't.
Well, you have to come here and visit sometime. It's a very nice place to
Sure,
go.
I will go one day.
Yes.
Yeah, I will. I will be waiting for you, so you have to come, guys.
I think that we have to prepare like a tour for meet
Yes.
Yeah,
all
it will
yes.
be so nice, so cool.
Mhm.
Okay, I think Carlita cannot read yet, but Liz and Salome can help me, please,
Sure, teacher.
with the one paragraph each one.
Okay. Screening is a way of identifying an increased
or greater risk for a condition, although they do not yet have any signs or symptoms. In some cases, mass screening large number of people, is appropriate, for example, in the past for tuberculosis. In other cases, only those with high risk factors, like a family history of conditions such as cancer and diabetes, and screened. However, there are a number of problems with screening.
There are always false negatives, cases where a patient has a disease but screening does not identify it. There are also positive, where someone is told they have a disease when in fact they do not. Furthermore, with some diseases, early identification is of no benefit to the patient as there is no treatment available.
Okay, so I don't know if it's clear the meaning of screening. It's a synonym we can use is detection. And if you have any other questions about vocabulary, please let me know.
I don't have teacher.
Salome, maybe you or
No,
something that
teacher,
is not understand.
I think it's clear.
Okay. Uh, okay.
Everything clear, teacher.
By the Okay, Carlita, I was about to asking you if you can read something or not.
Yes, yes, teacher. I rested too many days. I want to practice again.
Okay, okay.
Yes, please.
Let's continue then. So please, Carlita, can you read this box for us?
Common screening test. Condition: neural tube defects and Down syndrome risk. Test: AFP. Subjects: pregnant women. Frequency between 16 and 17 weeks. Breast cancer test mammography. Subjects: woman 15 till 17. Frequency every 3 years. Cervical cancer test smear test. Subjects: woman 20 till 60. Frequency every 3 years. Uh, Cardiovascular disease test blood cholesterol. Subjects over 40 years with high risk factors. Frequency every year. Secondary prevention. Cholesterol over 4. Blood cholesterol is the test. Subjects, patients with heart disease. Frequency every 6 months. Diabetic retinopathy. Test ophthalmoscopy. Subjects, patients with diabetes. Frequency every year.
Okay, thank you very much, Carlita. Well, as you can see, there says in the first line, AFP. Do you know the meaning of that letters? It means alpha fetoprotein in blood. I don't know if you know the meaning of that kind of test, but it is take of the fetus liver about the 3 first months of development. I don't know if you have any question or if you have another kind of tests that you usually use in your consultation and you can add here to our in our box. Hello?
Maybe the tuberculosis one. Tuberculosis.
Okay.
Uh,
TBC?
it's, I think, the back test, maybe.
Uh-huh.
I'm not sure. Yes,
Yes, it is. And which will be the frequency?
I think. Well, it's not we don't have a frequency, but if we have the symptoms, we do it.
Okay, maybe in some places, I think there is a frequency between 6 months. Um, I don't know how much time the treatment eh, should be during, but the patients maybe in the last steps of the treatment, they have to make another tests. Am I right? I'm just telling that because I remembered about my rural year. So
It usually is a 6 month treatment, but I'm not sure if they take another test at the end of the treatment. Maybe I think it sounds reasonably.
to
I think,
control maybe. I just
yeah.
remember something kind of that. I don't know if it's the correct thing, but I just remember a kind of that.
I think after 6 months, we make the exam at the year, maybe to prove that the patient is
To
right.
control.
Only to control.
Okay, so which kind of tests do you have? Which ones else? Mm,
Maybe for diabetes, uh,
yeah,
it's
it's
like,
very common now, right?
yeah.
And which frequency would be?
Uh, I remember that if you have a familiar with this with diabetes, yeah, is each control that you go to the doctor, and when you have diabetes, you have to to make this exam three cada 3 meses, 3 months.
Each 3 months.
Ajá.
Yeah,
Yeah.
okay. That's interesting because here we don't have for diabetes, but I'm pretty sure it's very common now, especially. Now we have the most common one. Do you know what am I talking about?
COVID?
PCR,
Yeah, COVID, yeah, PCR.
COVID one. Yeah,
Yes.
for everything and every person.
Yeah, that would be the most common one. And I don't know if you are agree with me, but I think Elisa is another one that is common, or
Yes,
you
that's
don't
true.
think? Okay, for of course it's for some um how can I say, for more I just forgot the name of the diseases. But maybe someone tell me that besides PCR,
Antibodies?
I'm sorry?
Antibodies for Elisa?
Yeah, but it's the most common or it's the best test after PCR. Is that correct? Or is not?
I think after, yes.
Yeah? Okay.
Mhm.
Yes, someone tell me that Elisa is one of the tests that are most with the most correct uh, answer, more or less like 90% of truly results, right?
If I'm not wrong, Elisa works for the 70%. Uh, yeah, and PCR is over 90%. That's why we recommend the PCR.
Yeah.
But I'm not that sure. Statistics fails, so I'm not sure.
Yeah, that's right. But I was listening that this morning, and I was a little bit shocked, but it's impressive.
Yeah, we
Okay.
ask Elisa because it's cheaper. It costs like 250 bolivianos, and PCR is 800 bolivianos, so it's almost three times
Wow.
the price.
Yeah, I didn't know it was so much money. I don't know. Well, I don't know if you did that test for your families.
I did, because after of my rural year, I returned to my home. So I went away in my room for 1 week, and then I made the test.
Wow. And it's like that kind of expensive there.
Yes, it cost me 130 or 40, more or less, more or less.
Dollars.
Yes, dollars.
Wow. Wow. So I better get it at home.
So I won't travel again.
Yeah. Okay. What
Exactly.
about you, Salome?
I took the test the same of Liz when I finished my rural year because I was in contact with positive patients with COVID, but I be negative result, and after that done the same that Liz don't did. Be in my room far away from my family like 1 or 2 weeks.
Okay.
And
We're in quarantine too.
yes.
Okay. Okay. So
I
Liz,
found
can you read?
a picture. Sorry, teacher.
No, I'm so sorry. I have a little delay. I don't know. I'm so sorry.
I
Continue,
found a
please.
picture. I was in a course of COVID, of update of COVID,
Uh-huh.
and I found the different kind of test. And the most useful and the most sensible is the PCR, is el hisopado,
Okay. That's
because that the picture says that in the PCR you take like a little bit place of the ADN of the virus, and
Mhm.
you reply it. And that's why you detect if there exists the virus or not. So this is more sensible, in that has the high specificity and sensitive. And after that
Mhm.
is the ELISA test.
Okay. That's interesting. We have to know, I think, because someone told me that the PCR was good, but not that good because maybe to find immunoglobulins A or M. Am I correct?
Yes, like for example, the ELISA and PCR, the way to take is like is with el hisopado, es con el hisopado, but in the PCR you take part of ADN And with ELISA, you take with the isopado too, but you put in like space of rapid tests, that's okay. And it's not too much specific. And then after
Yeah,
that, we have
yeah.
the faster test that that's definitely, we don't use it. I don't recommend it because in this course, the doctor said that when you have the COVID, the
Mhm.
faster proof or the faster test, don't give us any result because the virus is active. When the faster tests are functionally is when you had COVID more or less 2 weeks ago. Then the faster tests are gonna make positive maybe. So I think the most I prefer the PCR with isopod.
Yeah. Yeah, I was hearing something like that. Okay, thank you very much, Liz. Please, can you read? We will take turns, okay? The first one is going to be Liz, the second paragraph, Carlita, the third, Salome, and the fourth, me, and that would be okay?
Okay, teacher.
Okay, the following vaccinations are recommended for travelers to South Asia. Hepatitis A, more immune globulin. Transmission of hepatitis A virus can occur through direct person-to-person contact, through exposure to contaminated water, ice, or shellfish, harvest in contaminated water, or from uncooked fruits, vegetables, or other foods.
Hepatitis B, especially if you might be exposed to blood or body fluids. For example, healthcare workers have sexual contact with the local population or be exposed through medical treatment.
Japanese encephalitis. If you plan to visit rural farming areas and under special circumstances, such as no outbreak of Japanese encephalitis.
Okay, malaria. Your risk of malaria may be high in these countries, including cities. Travelers should take an effective anti-malarial drug.
Rabies. If you might have extensive, unprotected outdoor exposure in rural areas.
Typhoid fever can be contracted through contaminated drinking water or food. Large outbreaks are most often related to fecal contamination of water supplies or foods sold by street vendors. Vaccination is particularly important because of the presence of STP, strains resistant to multiple antibiotics in this region.
As needed. Booster dose for tetanus, diphtheria, and measles, and one-time dose of polio for adults.
Okay, thank you very much. So while you were looking a vocabulary, maybe you can contrast to your countries if you have that kind of diseases. I think, for example, malaria for Bolivia, I don't know, but I never heard about it. What about you, Carlita?
Well, it's very typical of the oriental area in north of La Paz, actually, like that that really tropical La Paz area.
Wow.
It's very common, and also dengue, chikungunya.
Yeah, I heard
Yeah,
about Zika, chikungunya, dengue, but not malaria. That's
we
a
had a lot
surprise.
of cases. Yeah.
Wow. Okay, and what about you guys? In Ecuador is the same?
Here is really common malaria, um, Zika, and dengue.
Um, I'm so sorry. I never heard about malaria here in South America. I don't know, maybe in Brazil. I'm never in Bolivia. I thought I never heard about that. Okay, do you have any questions with about this? Some words you cannot understand?
Maybe teacher in the first paragraph in the third line says harvest, shellfish harvest. I don't know what does it mean.
Shellfish is like ah, in Spanish. I forget the name in Spanish. It's um some kind of I don't know, jellyfish is the same, but harvested is is like cosechado.
Cosechado.
Okay.
Yeah, let's find out what is shellfish.
Mariscos, creo.
Mariscos, yes.
That's I forgot. But harvested is like cosechados.
Okay. Thank you, teacher.
You're welcome. I was confused about jellyfish. Do you like that kind of food, guys? I don't like it.
Really?
It's
I don't like.
delicious.
Yeah, I know everybody tell me that, but I don't like it.
Nothing.
Nothing.
Are you allergic?
No, but I think I have a kind of trauma because some people kill the fish in front of me, like I don't know, so badly, and I since that time I cannot eat fish.
But maybe only fish, or you eat shrimp, or I don't know.
No, not even that. I I taste shrimps, but I don't like either. But special fish, I do not like
An octopus.
anything, any kind of fish.
The octopus or squid are delicious.
Less that. Oh my god.
I have the same problem. I think it's because we don't
Yeah,
have,
Carlita.
yeah, we don't have sea, so we aren't used
That's why.
to. Yeah, I think that's why.
Yeah. People tell me when they made a paella or something, and I'm just like eating rice, and they tell me, "What is wrong with you?" And I'm like, "Whatever, I don't like fish." That would be the first reason, right? We don't have sea.
Yeah,
Maybe.
I think it's that.
Yeah. Okay. So
I wanted to ask how I say fecal contamination. It is right, or how I say facial
fecal, fecal, it's
fecal.
okay.
Ah, okay. Thank you.
Fecal contamination.
Okay.
do you know the meaning of booster? That is in the last line,
No, teacher.
as needed. Booster, if you find out in the dictionaries, you will find that it's like a high of pressure. I don't know if in this if in this line it says like that kind of doses for tetanus may cause booster, like high pressure. Okay.
I kept thinking about food. I don't believe.
What?
I kept thinking about the food. I can't believe it that you don't eat any seafood.
You still surprised?
Yes, it's because I don't know. I think everybody eats, but now I learned that not everybody.
Yeah, yeah. I'm not that kind of the finest paladar, so I'm so sorry, guys.
What do you prefer to eat?
I'm sorry?
What do you prefer to eat?
Meat. Oh, but no, not that chicken. Chicken is the best for me.
Uh, I was thinking about seafood, and I remember that I never taste or prove or eat the oysters.
You didn't prove that?
No, no, I don't try it because in me it's a little bit rare because they don't cook the oysters, so I don't know. I'm not sure about that.
I don't know. It's like viscoso pero sabroso. I really don't like. What about you, Salome?
If you cook the oyster, it's like I don't like the oyster, but sometimes I tasted it. When you cook it, it's like the texture like a bubble gum. Uh,
Yeah.
it's not it's not good. The flavor and texture both are so bad.
That's interesting.
I don't know, but I think I cannot eat something that is looking at me because I know they have eyes, they still have eyes, and it's like surprising for me. That's why I don't like. I think because I eat meat or chicken, and they don't have eyes by the time I'm eating, so I think it's better for me.
Yes, and have you think be vegetarian?
Yeah, I try. Um, Yesterday I went to eat some vegetarian food. Maybe I don't know what is the name. Lentejas. Uh,
Let me search.
Lentils, maybe.
Lentils, yes.
Hamburger of lentils, and it was so good, guys. You have to try it too.
Really?
Thought it was like, ugh, I don't know, so kind of weird, but no, it was so good. Okay, I think we understand most of the texts, right?
Yes.
Yes, teacher.
Okay, we can continue. Then we have the epidemiology unit. Okay, so we have the rate, the study of the spread and control of immunity. Its epidemiology requires analysis of frequency, the number of times something occurs in particular period. We talk about frequency using one combination with rate, as we have in our examples: birth, death, mortality, cause, fatality, and survival rate. It would be equal like The first line, the number of births in a population group of people. Death or mortality, the number of deaths in a population. Case fatality, it would be the rate of deaths from a particular disease, and survival, it will be the number of patients still alive after treatment for a particular disease. Okay, can you read the little boxes, please, Salome?
Okay, the birth rate in Singapore is 10.2 per 1 million population, 1,000 population. Yeah, the infant mortality rate in Singapore is 3.0 per 1,000 live births. Other words used to talk about frequency. Malaria is common in many developing countries. Malaria is uncommon, rare in developed countries.
Thank you. And yes, malaria is common in many developing countries like Bolivia, and I didn't know. Okay.
It's good to know.
Yeah, that's good to know. Okay, so maybe, I don't know, for your countries, the Health Ministry of Health has any specification about vaccinations, especially vaccinations, or not? Maybe fiebre amarilla
What is the
or
meaning of
some
vaccination, teacher?
vacunas
Okay.
o vacunaciones.
Yes, we don't have for malaria, but we have for fiebre amarilla,
Mhm.
yellow fever, and this is one vaccine for all your life. Before until 2010, we have 2 doses for yellow fever. The first doses, and after 10 years you have to take the second one, but since 2011 we have only one doses for a life.
Okay. Okay, Carlita, do you know any specification here to come to Bolivia?
We did exactly the same. We worked with two vaccines, then we passed to just one vaccine for life.
Okay, thank you very much. Okay, Carlita, can you read this, please?
Sure. Incidence and prevalence. The prevalence of a disease is the number of people in a population who have the disease at a particular time. The incidence of the disease is the number of new cases of the disease during a particular time, I think. The incidence of malaria is high in many developing countries or low in developed countries. The incidence of HIV infection is highest in sub-Saharan Africa. The incidence of HIV infection is lowest in the Caribbean. Note, you don't say the incidence of malaria is common. The incidence of a disease in different groups are often compared. Rheumatoid arthritis is more common in females than in males. Rheumatoid arthritis is less common in males than in females. Men and women are equally affected by restless leg syndrome.
Okay, do you have any vocabulary question here?
No, teacher.
I don't have.
Okay, and I don't know if you have any kind of incidents, specific incidents in your countries that are the most common ones.
COVID, I think.
Yes.
Yeah, it's the example of the year.
And I can't believe that I
Okay.
thought that with the vaccine, maybe the things are gonna be more controlled. But have you listened that a new type of COVID is coming again?
Yeah, that's right. And I heard about the secondary uh, effects that has this vaccine, right? Maybe like an allergic ones. I heard about that. I don't know if it's the same you heard.
This is a big topic because how I am a nurse, I know what is the many phase that a vaccine have to pass or have a process.
Mhm.
And I remember that all kind of vaccine of the different part of the world was in second phase. And mm, all the process for make a sure vaccine maybe take 4 years, like 2 years, and the largest until 4 years. But in the best of the case as 2 years, but this vaccine is only in 1 year. So I am not sure if I'll have a good result in this case, but for other way, the experiment in the in the monkeys was a good results. But I'm not sure if maybe it will have a second effect until 1 year. After 1 year, we apply the vaccine. So I think it's not sure, totally sure that we have that maybe have to be the a vaccine.
Yeah, that's right. Besides, I think because of the life of virus, it's like mutation by mutation, right? It's not like it will be the first one the whole life. So I don't know
Exactly,
how many vaccines we can
exactly.
we can resist. I don't know, guys.
I
I
mean,
don't want to get a vaccine for that.
I think the vaccine doesn't have has sense to me because it's like the flu. You
Yeah,
take a vaccine every year, but the flu always changes. And it's the same with COVID. So I think the COVID never ends.
yeah,
Maybe
yeah.
I
That will.
think we will have a tetravalent vaccines, but that will be with the years.
Uh-huh.
Because okay, the COVID change like let's say each year maybe, for example. But I think with the tetravalent vaccine, maybe we can control this because this is like a sarampion. Years ago, the sarampion killed a lot of children, but with the vaccine, it's not
Yeah,
like disappears. No, oh, actually, disappears sarampion, but in the years ago, have take time for control this disease that was sarampion. So I think the COVID will be the same. Many vaccines and years for control this, and maybe we have we the result will be a tetravalent vaccine. I think that in the best of the case.
yeah, that's right. I agree with you guys. Okay, so the incidence now of COVID maybe it's high in United Kingdom. I heard that too. And by now it's low maybe in South America. Can we put that example?
I have a question. The incidents is different to prevalence, I think. So I think incidence is the cases that we had before, and the prevalence are the new cases. I don't know if I am wrong.
Okay. According to this book, the prevalence of a disease is the number of people in a population who have the disease at a particular time. And the incidence of the disease is the number of new cases. You are telling me that this is that can we switch the
Ah, yes, that's true.
meaning?
Yes, 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 yes.
Okay. So is it understand now?
Yes, yes, teacher.
Okay.
Yeah, yes,
Okay.
yes, yes, yes. That's true. I was confused. Sorry. It's true.
Okay. It's okay. So we're going to here. Association and causation. Liz, can you read it, please?
Yes, teacher. Studying the incidence of disease in particular groups of people can lead to the discovery of causation. What makes it occur? For example, the high incidence of lung cancer among cigarette smokers suggests that smoking is a causative factor in the development of lung cancer. However, care
Mhm.
must be taken not to assume every association between a disease and a measured variable is causative. To say there is an association between two things simple means that they occur together in a certain situation. For example, several studies have indicated high rates of lung cancer in cooks. Although this could be a consequence of their work, perhaps caused by carcinogens in fumes from frying. It may be simple because professionals cooks smoke more than the average. In other words, smoking might confound the association with cooking.
Okay. So do you understand the mean significance of these two words? And if you have any vocabulary questions, please let me know. For example, I think fumes, it's like vapores.
Teacher, what is the meaning of average in the before one line, the last line?
In other words, smoking might confound, cooks smoke more than the average. Okay,
El
average is,
promedio.
yeah, that's right.
I'm
What?
sorry.
No, it's okay. It's okay. I want you to understand and explain each other. It's okay. Don't worry.
Thank you,
There's
Violeta.
another
Thank you.
word that means I don't know if you find out bias. I don't know what is it. Oh. Okay, but the meaning, if you find it, it's like parcialidad. I don't know if it's in this slide. I think it's not.
Okay.
So, like a resume, causation would be something referred to the main cause, right? That would be the cause for that disease. And association is when you find out some signs or symptoms that could be referred to one disease or another. Is it okay?
Yes, teacher.
Yes, teacher.
And medical ethics. Oh my God, I don't know if you can read this. We have these guidelines, okay? Can you read it, please? The first one is Salome, the second, the 4 to 6, Carlita, and 7 to 9, Liz, please.
Who was first, teacher? Sorry.
You.
Okay. Care mean protecting and looking after someone. In an example it could be make the care of your patient your first concern. The second one, professional competence mean level of specialized knowledge and skills. In an example is
No,
recognize that.
can you read 1, 2, and 3, please?
I don't understand. Only
The numbers, and
okay.
then you will find out the examples that
Okay.
is on the left side.
Or on the confidential is private secret. Okay, for professional competence is recognize the limits of your professional competence, and the confidential is respect and protect confidential information.
Uh-oh, I'm lost.
Yes, it's not equal for the example. Is
Yeah,
I don't know.
okay. Well, I will read this. Okay, make the care of your patient your first concern. And care means protecting and looking after someone. 2, treat every patient politely and considerately. 3, give patients information in a way they can understand. That will be the guidelines, okay? Who was 4 to 6, Carlita?
Me, okay. Keep your professional knowledge and skills up to date. 5. Recognize the limits of your professional competence. That means level of specialized knowledge and skills. 6. Be honest and trustworthy.
Okay.
7. Respect and protect confidential information. Confidential, private, secret. 8. Make sure that your personal beliefs do not prejudice your patient's care. The means have a negative influence on. And 9. Act quickly to protect patients from risk if you have good reason to believe that you or your colleague may not be fit to practice. Fit to practice means in a suitable condition to work.
Excellent. Do you have any questions about vocabulary here? Prejudice. I was looking for the correct speaking for prejudice, and it's
Yes,
prejudice.
prejudice is correct.
Prejudice is correct.
Okay.
Okay, talking about ethics, this might be the guidelines. I know you have some kind of guidelines or protocols then you usually use. And if you can add something, you can do it. Okay? And as you can see at the bottom of the box, there is a page. If you wanna go and find out for more examples about guidelines, okay?
I think more than protocols, we have like principles of bioethics.
Right.
To know, to say someone, for example, is beneficent, no maleficent, that
Mhm.
kind of principles.
Okay. That every single professional in health must use, right?
Of course.
Okay. So can we continue?
Yes,
Yes,
teacher.
teacher.
Okay. Here we have some other bioethical issues. Can you read it, please, the first paragraph, Salome?
Sure. Ethical issues. Euthanasia. Should the medical profession help the terminally ill to end their lives when they choose? Genetic engineering. Should we permit an embryo uh, to be cloned, copied exactly to replace a child who has died? Should parents be able to select the genetic makeup of their children to produce so-called designer babies? Human fertility. IVF, in vitro fertilization, has made it possible for infertile women to have children, but should this include women long past the normal age of childbearing? Embryos can be frozen and implanted in the mother at a later date, but should this require the consent or permission of both parents if the marriage has broken down? What are the rights of a surrogate mother, one who carries a child, for a woman who is unable to do so over that child?
Okay. So here we have this childbearing. It's
Mhm.
like parto, okay? And surrogate, it's like substitute.
Mhm.
Okay. So what do you think about these specifically issues?
That is a hard topic, I think, because here we have about our, ¿cómo te dice? Creencias, truths.
Believe,
Beliefs.
yeah.
Yes, about that. In my case, or in my opinion, I only can talk about euthanasia
Mm-hmm.
because I agree with that. It's not because I am a bad person, but for thinking like this. But I think in some case that the patient are really in bad conditions, that maybe don't have a good life, have a, I don't know, how do you say, a tratamiento fútil. That is the meaning of the person, the doctors or the medical area know that that patient want or couldn't uh, have a support, or be,
Recovering.
yeah, be recovering, and but anyway they do the treatment, and maybe we waste the recourse for other person. That maybe sounds cruel, but I think that sometimes we have to be conscientious to know which patient
Conscious.
will have the opportunity to recover. and which patients not.
Okay. Okay. I thought that between you guys, Salome won't be agree with euthanasia. So it surprised me. It doesn't mean that you are a bad person, okay? But it's interesting.
Yes, it's only that I am agree with. The other are disagree.
Yeah, okay, that's a good point. What about you guys?
Well, I agree totally with euthanasia because I was working in the oncology institute, so I saw so many cases, the many cases that they need to end up the suffering because they don't die as fast as they wanted, and they
Mhm.
suffer. It is a heartbreaking situation that doctors can do nothing because obviously we are here to give life, nor taking it. But sometimes I see that like a helping too. But we never do it like. But I think it's more ethical to do it.
Okay. Because here in Bolivia, it's not permissive, right? The law.
Yeah, the law doesn't permit it.
Yeah.
Uh, Teacher, sorry, guys, I have an exam in other class because it's 6 p.m. So can I disconnect it, teacher?
Yeah, please, but I will share with you my little
Okay,
questionnaire for
really
you.
sorry, I have other exam. Sorry.
Okay, don't worry. So please, can you do it, guys? And we will continue. Thank you very much.
Okay, bye, Carlita, bye, Liz, bye, teacher. See you.
Bye.
Good
Good
So,
luck,
luck.
bye,
Salome.
Salome. Good
Let
luck.
me know tomorrow in which hour I have to be. Can I
Okay,
be
I will tell you.
5:30? Okay.
I will tell you. Don't
Okay.
worry.
Bye, teacher.
Bye. Get good luck. Okay. Okay, guys. So we have a few minutes, and I know we tomorrow we're gonna talk about a lot of stuff, but now let's continue. With assisted dying, a medical student has made. And can you read it, please, Carlita, the left side, and the right side will read it. Liz, please.
Okay. A 53-year-old woman with incurable muscular dystrophy flew to Switzerland to end her life. Assisted dying is legal in Switzerland but illegal in the UK. Opponents of euthanasia or mercy killing argue that legalization will lead to abuse and call for doctors who participate to be struck off. What Britain needs, they claim, is better palliative care and more hospices for the terminally ill to allow such patients to die with dignity. This follows a recent US case where the husband of a woman who had been in a persistent vegetative state for 16 years was successful in having artificial feeding withdraw in spite of opposition from his wife's parents.
Equal to removed from the GMC register and banned from practicing medicine in the UK. Palliative care, treatment to relieve rather than cure symptoms. Hospice, equal to facility providing care for terminally ill patients. Terminally ill, it's equal to not expected to live. Persistent vegetative state, unable to speak or follow simple commands, does not respond in any psychological, mindful way.
Oh, thank you very much. I cannot read it. I don't know. How can you do it?
I had the book. That's
Oh,
why.
that was okay. So I don't know if you have any questions here for vocabulary.
Struck off. What is the meaning, teacher?
Where is it, please?
Um, in the fifth line, in the right,
Oh,
no, left side.
to abuse and call for doctors who participate to be struck off, right?
Mm-hmm.
Okay. The meaning is like tachado.
To be struck. Llamar a los doctores quienes participan para.
Es como decir, it's like when you say that they won't take part of that.
Okay. Now I understand. Thank you.
Stock off, but the meaning of stock off is like patab. But in this case, it's like that they won't took part on that.
Okay. Thank you.
Do you know the meaning of withdrawn? Withdrawn?
No.
Okay, it's retired. Like took off. Retirado.
In the right side, in the second line, we have the word band or band. I don't know. Up, a little bit. In the second line. Yes. No.
Stock off.
Under stuck off.
Remove them.
No.
Remove them
Band.
from under palliative care.
No. Up. In the second line. Yeah, that's right.
Okay, and bones from practicing medicine in the UK, right?
Mm-hmm.
Okay, I cannot read. Remove from the GMC register.
I think
Yeah.
banned means baneado, like struck off.
Yeah, that's right. But I didn't understand. She was asking me about band.
Yes, band.
I'm sorry, I cannot hear. I have a little delay and I was looking for that word. I thought you cannot read it. Remove from you. Okay, do you have any more questions?
I think no, teacher.
Yeah, I think it's clear.
Okay, now it's clear. And we have research studies, case control studies, and here are some extracts from a medical textbook. In a case of control study, a group of people suffering from a disease that are the cases is compared with a group who do not have a disease but are similar in other ways, the controls. The two groups are the participants in the study are compared to see if they were exposed to a possible risk factor or not. A risk factor is something which may contribute to the causes of disease. This type of study is often used as a first step in identifying the cause of a disease. So I think this is pretty much clear.
Yes, teacher.
Yes.
Excellent. And a cohort studies. In a cohort studies, a cohort, especially used in an investigations, okay, of people that are the subjects, in this case, who are similar, is studied over a period of years, a longitudinal study, to determine if there is a relationship between exposure to a risk factor and development of a disease. At the beginning of a prospective study, none of the subjects has the disease. They are followed up for a number of years, and at the end of the period, those who have developed the disease are compared with those who have not. In a retrospective study, the researchers look back by studying hospital records, for example, at what has happened in the past, comparing subjects who have developed the disease with those who have not. In a cohort study and in a case control study, the subjects are only observed and there is no intervention such as drug, treatment, or surgery. A cohort study is a more reliable method of identifying the cause of disease than a case control study, but for proof of cause, a trial is needed. I don't know if you have any questions of vocabulary here.
I think it's clear.
Yes, teacher.
Okay, so we have the trials at last. Okay, Liz, can you read it for us?
Yes, trials. In a trial, a group of people who are suffering from a disease are given a particular treatment. To determine the effectiveness of the treatment, a controlled trial is performed. Two groups are studied. One group, the study group, is given the treatment and the other, the control group, is not. The controls may be given a placebo, something which seems to be identical to the treatment but which has no effect. If there is an equal possibility that patients may be selected from the study group or for the controls. The trial is said to be randomized. A randomized control trial makes bias, error in a study which influences the results, less likely. An additional way of removing bias in blinding, patients do not know if they are receiving the treatment or the placebo. If, in addition, the researchers do not know who is receiving the treatment, the trial is a double-blind trial. Randomized controlled trials are used to test treatments or preventive measures.
Okay. So I don't know if you have any questions here. And this is the word that I was telling you about before, bias, right? It's like parcialidad.
Mm, I think here we call it sesgo in statistics. Sesgo.
Yes, that's true.
Yeah.
Bias?
Yeah. When we have something that influence the
Mhm.
study, the results, so we call it a sesgo.
Okay. Thank you very much. Everything is good now?
Yeah, I think
Yes,
it's
teacher.
clear.
Okay. So for tomorrow, who's going to be first?
Can I start tomorrow, please?
Yes, I think yes. Okay, Carly. Then Liz goes second.
Yes, teacher, it's okay.
Okay. And Salome. Okay, guys, thank you very much. I know that we're going to have so much topics to talk about tomorrow. Okay, have a good night.
You too, teacher. Thank you
Thank
so
you,
much.
teacher.
Thank you very much. Have a good night. Bye. See you.
Good
Bye
night,
bye,
teacher.
Carlita. Bye, teacher.
Goodbye.